Hello everyone, are you a woman out there and you've not done your screening for cervical cancer? Have you taken the human papilloma virus, that's the HPV vaccine? So please, this video is for you. So don't miss out on this episode. And today we are bringing in a specialist who is a sexual and reproductive health expert from Nigeria by name Dr. Chioma Wakama Akano, popularly known as Dr. Zobo. So don't miss out on this episode. This is Talk Pregnancy with Dr. Nuela, where we tell you all about pregnancy and other women-related health issues. So let's get right in. Let's welcome Dr. Chioma. Hello, Dr. Chioma. You're welcome to Talk Pregnancy with Dr. Nuela. I'm so excited to have you here. Thank you for honoring my invitation.
Thank you very much, Dr. Nuela.
Okay, so can you tell the audience who you are? Just tell us about your work, the work you do, and who you are in general.
Okay, hi everyone. My name is Dr. Chioma Wakama Akano. I'm a medical doctor, reproductive healthcare physician from Nigeria. I am also popularly known as Dr. Zobo. I'm a digital health content creator, and I create content to educate and empower women and adolescents on their reproductive health care and rights. I think that's me in a nutshell.
Wow. Thank you so much for coming.
Thank you.
Okay, Dr. Zobo, can you tell us what cervical cancer is all about and why should women know about cervical cancer? Because I know there's a lot about it and there are some myths surrounding cervical cancer, especially with the vaccine. So to know about the vaccine, we need to actually tell these women what this cervical cancer is all about. Can you tell us what it is?
Okay, I'll start with telling us what cervical cancer is and then go on to tell us why it's important. So cervical cancer is this cancer that affects the cervix, and the cervix is the neck of the womb. That's the junction between the uterus and the vagina. So basically, for you to understand, when a woman is having a baby and the doctor or midwife needs to check and they're like, oh, you're 2 cm dilated, 3 cm, 4 cm, so that part where they check to know how dilated you are before the baby can come through, that is the cervix. So when any cancer that affects that area is what we call the cervical cancer. Now it's very important and it's something we should be worried about because firstly, statistics show us that let me use Nigeria for instance. In my country, 14,000 women die annually from cervical cancer, and globally it's like the 4th cancer affecting women globally. In Africa, it's the 2nd commonest cancer. But the irony of it all is the fact that this cancer is almost 100% preventable. So imagine having a cancer that you can prevent, and then women are still dying from it. So I believe it's an error for women to be dying. 14,000 women in my country are not to be dying from a vaccine preventable disease. And so that's why it should be a source of concern. It should be a topic on everyone's mind and mouth. Yeah.
Wow. That's amazing because when people talk of cancer, they always feel like there is no cause of cancer. Cancer just comes from nowhere.
Yeah.
But if you can be saying that it's almost 100% preventable, it means we have a cause of it. We know the cause of this cervical cancer.
Yeah.
So what is the main cause of this cervical cancer?
Okay. So about according to the WHO, over 70% of cervical cancer cases have been found to be caused by the human papilloma virus, HPV. So this virus is a sexually transmitted infection. In fact, it's one of the commonest sexually transmitted infections that exist. It's so common, and one of the things is with HPV is viral, so it can be self-limiting. It means somebody can have it and not know for the rest of their life. Like it gets to a point where your body clears it by itself. However, in some percentage of people, their bodies are unable to clear it, and it could be the high-risk strain or the low-risk strain. Now, the low-risk HPV will be responsible for the genital warts and all those other ones that you're seeing visibly, and genital warts can also be treated. But the high-risk strains especially the strains 16 and 18, have been found to be implicated, that they're implicated in cervical cancer. You know, they are the strains that can cause cervical cancer. And when this happens, there is a problem. And because you don't know which one you're going to get, so everybody has to work on prevention. Now, there are other causes or other risk factors, I would say, other risk factors of cervical cancer. While there is no known cause, like one main cause, there are other things that have been seen to be associated. Firstly, genetics. So if you've had a history of cancers in your family, especially on the maternal side, especially female related cancers, breast cancer, uterine cancer, any ovarian cancer and like, then you, or even cervical cancer, if your mother, your sister, any woman in the family has had it, then you're at risk. It doesn't mean you will get it. You must get it, but it means that your risk is higher than someone who doesn't have that history in their family. So you should take prevention seriously. Now, women who smoke are also at risk. Another risk factor is having multiple sexual partners. So the more sexual partners, easy math, the more sexual partners you have, the more likely you would have come in contact with HPV, and you wouldn't know which strains you're coming in contact with. So that's it. Then, interestingly, it's also been seen to be associated with girls who have early sexual debut. So the very first time they had sex is very early on in their life. If you had sex very early, whether it was by violation, defilement, sexual abuse, any form. Of course, if it's below 18, we already know that you can't give consent. So any sexual exposure can actually lead to HPV, can cause that. So there are different other risk factors, but I think these are like the major ones for now. Okay, thank you very much.